Hello, friends. I welcome you to my YouTube channel, globally, wherever you are listening to me. I say welcome to my YouTube channel, The World of Viruses. Once again, my name is Professor Festus Sadu. Thank you for subscribing. It's really shows you have been liking my video channels, my videos, as seen in the number of people that have been subscribing. I thank you once again. But continue to subscribe. Today, I'll be talking to us on a very important topic, the virus and your liver. The virus and your liver. Do you know that the liver is the largest internal organ in your body? Do you know that? And that it performs a very important function in your body system? Yes, it performs a very important function in your body system. It is a critical organ. It's a critical organ in the human body that helps to support metabolism, how you digest your food, immunity, your digestion. It helps in detoxifying your system, and is the storage place for vitamins. It clears from your body toxins and other poisonous substances that may harm you. And yet, listen to this. This is the most interesting. As good as your liver is, as good as the function is, and yet your liver is the target of a group of viruses, which we refer to in the field of virology as hepatitis viruses. Not only one or two, but six. Not only one or two, but six of them are hepatitis viruses. Maybe you may be surprised that viruses even organize themselves into families. Yes, they do. They do organize themselves into families. What do we see? I say, yet your liver is the target of this group of viruses called hepatitis viruses. They are made up of different families. You can see from that picture we are seeing, you can see there are six types of hepatitis viruses: hepatitis A, hepatitis B, hepatitis C, and hepatitis B, and hepatitis E, and hepatitis G. Only two. The most interesting part of it is that only two as of now, only two of these hepatitis families are vaccine preventable. We are still looking for vaccines for the remaining group. So all of them, they attack our liver. They attack our liver where they cause different types of diseases, as we shall be seeing as the lecture is going on. Maybe you don't know this. Yes, they have one thing in common. They have one thing in common. They have affection for the liver. That's why the word hepatitis comes up. Because they have predilection. They have affection for your liver. They have affection for your liver. Although viruses are not the only cause of liver damage. One common sign that your liver is being damaged is the appearance of a yellow coloration of your eye. You can't miss it. And the other lighter parts of your body. You can see it. You can see that yellow coloration of the conjunctiva, of the sclera of the eye, yellow coloration. That is because the liver is damaged and bilirubin. And bilirubin is now being sent into your blood. That is why we are seeing bile and bilirubin is now being sent to your blood, to your blood. That's why we are seeing it in the coloration of the eye. It's not only in the eye we see the coloration. You can also see those coloration in other parts or in other parts of the lighter parts of your body. You can see it in the face, in the eye, in the face, in all the other parts of the body. All the lighter parts of your body, you can see those yellow coloration. That is showing that, yes, something is wrong with the liver. And you can see the yellow coloration all over in all the lighter part, or in the face, in the palm of your hand. We see all these things. This is a sign that that the liver is being damaged. Transmission. How is this virus transmitted? Yes. I told us earlier that there are 5 groups. They are not transmitted the same way. But hepatitis B, hepatitis C, and hepatitis G, they are all transmitted through blood, through parenteral blood, through sexual intercourse. You can say it, through sexual intercourse, through intravenous drug abuse, sexual intercourse. That's how it's transmitted. But for hepatitis A is transmitted fecal-oral, through our food, through contaminated food, when we swallow it. But the interesting thing is that, irrespective of how they are transmitted, they end up in the liver. They end up developing hepatitis in the liver, and we have been seeing some of those signs. As they infect the liver, as the different viruses infect the liver. The unfortunate thing is that even though there are 5 different groups, there are 5 different hepatitis groups, but they cause hepatitis. You cannot differentiate hepatitis caused by a specific virus without laboratory diagnosis. You cannot differentiate it. You cannot differentiate it. You cannot say this hepatitis from the pathology of the liver. You cannot say this hepatitis is caused by this specific family of the hepatitis virus until you do your test. The presence of virus-specific receptors, which are located in the liver cells membrane, facilitate the entry of the virus and set up infection, which can be acute or chronic. The disease normally starts in form of as acute. About 5% will transit to chronic, especially with the hepatitis B, where 1% of those 5% will transit to hepatocellular carcinoma, which is the liver cancer, which is usually the cause of death. Please let us know that it starts as an acute, from acute to chronic, and from chronic to hepatocellular carcinoma. This is what in the hepatitis B, for example, about 5% will transit to chronic, whereas 1% of the 5% will develop hepatocellular carcinoma. For hepatitis A, which I told us is ingested, is the route of transmission is through injection, entry through your food, through your food. The hepatitis A does not normally lead to hepatocellular carcinoma. It's milder in severity than hepatitis B. I've told us again that for hepatitis B, about 5% will become chronic carrier due to the persistent. What is giving rise to this chronicity in hepatitis B is because of the persistent and prolonged presence of one of the antigen, or one of the most significant antigen in the virus, which is called hepatitis B surface antigen. Hepatitis B surface antigen. This is the initial. This is the first indicator that you are infected by hepatitis B, and it's a bad omen. It's a bad omen. The presence of hepatitis surface antigen is a bad omen for the patient. I told us again, 1% of chronic carriers may develop hepatocellular carcinoma. About 1% will develop hepatocellular carcinoma. Whereas for hepatitis C, for example, about 50% will develop hepatocellular carcinoma. This is what I'm telling us right now. Hepatitis strongly disposes as compared with hepatitis B. Hepatitis C strongly disposes to hepatocellular carcinoma than HBV, about 50%. And yet, the bad news is that, there's no vaccine yet against hepatitis C. Scientists, virologists are still looking for vaccines against this hepatitis B. So, knowing this, be very, very careful. Be very, very careful. I told us one of the means of transmitting it is through injected blood, sexual injected blood. It can be infected through injected blood, through drug abuse, and so on and so forth. Alcoholism increases the chance of developing hepatitis C carcinoma. Please let's know this. If you are drinking, please consider it. Consider your liver. You may be doing a lot of damage to your liver. Hepatitis B, this is a very interesting one. Hepatitis B differs from all other hepatitis virus in that it does not exist on its own. It can't exist on its own. It needs to be carried. That's why we call it a carrier. Hepatitis B is the carrier for hepatitis D virus. But another important thing, significance of this virus is that when we have a co-infection of hepatitis B and hepatitis D, it gives rise to very fulminant form of hepatitis. Very fulminant form of hepatitis. That is co-infection of hepatitis D and hepatitis B. How do you know you have hepatitis? What I'm asking, what are the clinical manifestations of hepatitis? They are usually the same. I told us earlier at the beginning that you cannot pin down this particular hepatitis virus from the pathology of the liver. Not at all. You have to do antigen tests. You have to do some laboratory tests. Or you have to do the laboratory. Although from what I've told us already, although the level of severity may be different. The level of severity may be different. Characterized by jaundice. What do we see? Jaundice. Jaundice means yellow coloration. Jaundice of the eye. Jaundice of the sclera. Jaundice of the lighter part of the skin. Enlargement of the liver, which we refer to as hepatocellular. Hepatomegaly. Enlargement of the liver. You see, enlargement of the liver. Fever. Loss of appetite. Feel like vomiting. Pale feces and stools. We see all this, pale feces and stool, because the bile is not getting to your intestine and it's not mixing with the stool sample in your intestine. That's why we see instead of the stool becoming yellow or red or the normal color of stool, we see it's pale, it's looking pale. That is a great sign, one of the clinical signs of hepatitis B, that you are having hepatitis. That's one of the signs that we're having hepatitis. Another thing we see is the dark coloration of your urine because of bilirubin, because of the presence of bilirubin in your urine. This is a bad sign. It's not a good indicator. Dark urine. So if you have dark urine, if you are urinating and see that your urine is darker than normal, please run to your doctor. Well, there are different stages of hepatitis. Pre-jaundice, what do we mean by pre-jaundice? This means before the appearance of the yellow coloration. What do we see here? It can easily be confused with other diseases. What do we see? Headache, rashes, joint pain, vomiting. These are what we see. Enlarged liver, pain in the right side of your rib, pain in the right side of your rib, epigastrum. You feel like vomiting your food. You epigastrum, as if you have acid is coming from your mouth. At the end, appearance of pale color stool, which I already showed us already. A pale stool because bilirubin is actually not mixing with the stool in your small intestine. Those are the signs we see. What of this jaundice stage? I told you there are many stages. Jaundice stage, what do we see? Again, yellow coloration, jaundice of the mucous membrane, more emphasized right now in the sclera, in the skin, protein in the urine and the blood. Those are all the things we see. Hepatomegaly, enlargement of your liver, tenderness on the right side of your stomach, where the liver is. There's a bit of pain and it looks tender. Enlargement of the spleen, another hematopoietic organ, another organ where blood is being manufactured. We see enlargement of the spleen, enlargement of the skin. We see rashes, internal bleeding, and vasculitis, which is caused mainly by the hepatitis C virus. This is caused mainly by the hepatitis C virus. We can see the picture that's been projected. You can see internal bleeding. See the enlargement of the liver there and internal bleeding because of the small inflammation, vasculitis of the small blood vessels. That's why we see. That's what we are seeing there. It's mainly by hepatitis C virus. Chronic viral hepatitis only appears in hepatitis B, hepatitis C, and hepatitis D. I told us earlier, hepatitis A does not lead to chronic infection of hepatitis, but it's only limited to hepatitis B, hepatitis C, and hepatitis D. What do we see? What are the other symptoms? Other symptoms, which may not even be limited here, because you also see some of these symptoms in other diseases. Fatigue, the patient getting tired, even without doing anything, getting tired. Digestive tract symptoms, stomach pain, stomach trouble, dull pain at the liver, at the right side of the stomach, and elevated. Oh, this is a very, very important histopathology test. Liver enzyme, ALT and AST stand for liver enzyme. Because the liver is damaged now, these enzymes are flowing out on their own. Because the liver is already damaged. These two liver enzymes are flowing out, which eventually lead to its elevation in your blood. In fact, this is the very first thing the histopathology look at. And this is a very, very bad sign that the liver is being damaged beyond repair. What do we see again? What do we see again? Ascites. Ascites. What is ascites? Ascites is the accumulation of fluid inside our stomach. Inside our stomach, the belly becomes swollen. The belly becomes swollen because electrolytes, microelements are flowing to the liver, and you can see now. See the picture in your. See the picture has been projected. You see the big stomach because of hepatitis. Because of hepatitis, enlargement of the stomach, which is mainly caused by hepatitis B and hepatitis C. Now, haven't told us how do we diagnose it? What is the diagnosis? Are easily diagnosed clinically from those have told us all those symptoms: enlargement of the liver, enlargement of the skin, rashes, jaundice, easily diagnosed. But you still have to do. I told us that virus may not only be the cause of hepatitis. Other elements, other microorganisms may also cause it. So, but for differential diagnosis, we have to do what we call laboratory diagnosis. What do we see during the laboratory diagnosis? We see appearance in the blood of the various related antigen, of which I've told us one already. So hepatitis B surface antigen. This is the first antigen to appear. This is what is showing that you have seroconverted, that you have been infected and you have seroconverted. This is surface antigen. It's very, very significant. This is what laboratorians immediately look for. What do we see again? We see hepatitis B anti-S antigen and other related antigen. That will confirm. Not only that, you can even do your molecular test to test for the genome, for the RNA, DNA, hepatitis DNA, hepatitis B DNA in the blood. When there's DNA, it shows that it's a very, very bad omen for the disease. It shows that the virus is replicating actively. And the condition of the patient may be very bad. How do we treat it? Like other viruses, no response to antibiotics. Please know that. No response to antibiotics. Or especially those nations where anybody can just go and buy drug in any pharmacy without prescription. Please know this. Don't abuse your antibiotic while you are trying to say you are treating your hepatitis. But what the good news is that that's well-developed antiviral drugs. Very well-developed antiviral drug. There are about 6 antiviral drugs. Already by this time, you have talked to us earlier in my earlier presentation about interferon. These are the first line of action of defense against viruses. Again, we have lamivudine, very active, adenofovir, entecavir, tenofovir. These are all antiviral drugs. They are not antibiotic, please. They are not antibiotic. Don't go to the counter saying you want to buy this drug. Don't do self-medication, or you may be worsening your own condition. See your doctor immediately. Immediately you have been diagnosed. The doctor knows the right drug to prescribe for you. See your doctor or your physician. Prevention and control. How do we prevent? Sterilization. I told us some of hepatitis B, hepatitis C, and hepatitis G. They are all transmitted through unclean instrument. Contaminated needle, sexual intercourse. So make sure to prevent and control, make sure you sterilize. Drug abusers, please make sure you sterilize all your instruments. Vaccination is still the best way of preventing hepatitis A and B. Remember I told us earlier, out of the 6, only hepatitis A and hepatitis B are vaccine preventable. We are still looking for vaccine for the remaining one. So what is the vaccine prevention? The good news is that hepatitis B, because of its importance, the WHO has now deemed it right to introduce hepatitis vaccination into the expanded program of immunization. At the same time, we vaccinate children. It has now been introduced. Hepatitis B virus, hepatitis B and hepatitis A virus has now been introduced into the expanded program of immunization, which we are seeing on the board there. So you can see it. The slide on the board explains everything so well. So you can now be taken with other childhood immunization during the expanded program of immunization. We want to thank WHO for that. For hepatitis B, active prophylaxis. It should be given. This will be for hepatitis B. Let me quickly run us through this. After birth, it should be given immediately after birth. Then in 1 or 6 months, three doses. One after birth, which we can call the day 0, and then 1 or 6 months later. When a mother is surface antigen positive, remember I told us that is the main antigen showing that you are infected. After birth, such a child, such a baby from that mother should be given at birth 1 month, 2 months, and 12 months. It is recommended that babies born by HSA-AG positive mothers be given alongside with the vaccine. They should also be given the vaccine with the human immune antigen, immunoglobulin, human immunoglobulin. Yes. See your doctor and schedule your vaccination. Passive prophylaxis by human immunoglobulin. Please see your doctor if you have not got it. Even when you are well. I know even here in the U.S., when we go for our physical, we also, either we are positive or negative, we always take our hepatitis B virus just to show us how important this disease is. Yes, my last counsel as I'm about to finish. Are you thinking of marrying that beautiful lady or that handsome man? Yes. If yes, know your hepatitis status. This is me. This is a counsel from me. Know your hepatitis status before you tie that knot. So that in order that you don't infect yourself. You remember I told us hepatitis B can be infected, can be transmitted through sexual intercourse. So therefore, know your immune status. Know the immune status of the person you want to marry. Know your immune status. Know your HB immune status of that person you want to marry. If unfortunately the positive individual, if anyone is positive, that positive individual should get treated with the antiviral drug immediately from any of those drugs I told us earlier. The positive individual should get treated with the antiviral drug. And the fortunate one who is not positive but negative should immediately get vaccinated immediately. I hope you have really enjoyed my lecture this afternoon. Yeah, I like talking about hepatitis. It's such an important virus. So, which can develop into hepatocellular carcinoma, which can lead to hepatocellular carcinoma. I hope we should take this lecture seriously. If you are not subscribed, please. If you are not subscribed, I want you to subscribe. It's such an important lecture on your virus and your liver. Your liver is so important unto you. You will not allow any virus to destroy that liver. So please make sure you get your vaccine. See your doctor. When you go for your annual physical, your doctor, even without asking you, they are going to give you your hepatitis vaccine. So please, like always, I thank you before starting this one. Thank you for patronizing my YouTube channel. I can see it from the number of people that have been subscribing. Please continue to subscribe if you have not. Share, comment, and like. I would like to hear your comment. So thank you for listening once again. I'm very pleased to have spoken to you this afternoon. Have a wonderful day. And watch out for my next slide, for my next video. Thank you very much. Wherever you are hearing me, have a wonderful day. Bye.